It's the scary truth that infant babies are dying on a regular basis, dying in their own beds because of unsafe sleep practices. To make matters worse, many parents don't even realize that they're putting their babies at risk. Joining me with information on infant safe sleeping is Katherine Schiraldi, Associate Director of Franklin County Children's Services, along with Dr. Mysheika Williams-Roberts, Assistant Health Commissioner and Columbus Public Health. Nice to have you both here.
Thanks for having us.
These statistics were shocking to me, Dr. Roberts, because I really thought that we had gotten to the point where parents understood. But the difference here is there are changes from even the way I was told to put my babies to bed. So let's start with some of those changes before we get to that partnership that you're both working on. So Dr. Roberts, where and when and how should you put a baby to bed?
Well, it's pretty simple. We call it the ABCs of safe sleep. So babies should be sleeping alone, they should be sleeping on their back, and they should be sleeping in a crib. And that is the safest and best way for your baby to sleep.
ABC.
ABC.
Alone,
on their back, and in a crib.
Now, go ahead, I'm sorry.
It's also important that they sleep on a firm surface, so it's best that they sleep on a mattress as opposed to a couch. Again, if they're in a crib, you're going to avoid that. But sometimes parents or caregivers put babies down on a on a couch or a soft surface during the day or at times, and the babies really need that firm back and on their back, but that firm support while they're sleeping.
What can happen if they don't?
Well, the material that they're sleeping on, it can surround them. They can easily turn on that type of material as well, and they can end up on their stomachs, which is not where we want babies to be, especially if they're not supervised.
Katherine, I know that Franklin County Children's Services has partnered with Columbus Health in order to get this message out there. Are you seeing the message needing to be updated and retold because of what you're experiencing at Franklin County Children's Services?
Yes, absolutely. It's really important, the collaboration, because of the folks that we have contact with, the enormous amount of in-field work that we do, as well as who Columbus Health Department is also in touch with. So the more families that the two agencies can have contact with, the better. And it's also a generation thing as far as what is seen now as safe sleep wasn't 20 years ago. So it's not just our young parents now, but we want to get that message out to our grandmas and our aunties and foster parents and kinship providers, you know, the generations that are also taking care of young infants. We want to get that message out to everyone. So the collaboration is so that we can touch more people.
Get to more families.
Right.
Dr. Roberts, I mean, Katherine's right. When babies were born, they were telling me, put your babies to sleep in the crib on their stomach because they would choke. What has been the turnaround in thought?
Well, research has happened, and we've realized that really on their back is the safest place to be, because on their stomachs, what they can do is they can actually suffocate themselves by putting their face down on the surface and not being able to breathe. So over time, and as we've gotten more data and more research, we've learned that really on their back is the best place. And alone, and when I say alone, I don't just mean without another baby or another individual, but I also mean no blankets, no stuffed animals, no toys. Those kind of things can get in the way as well.
Katherine, I know that the people at Franklin County Children's Services are also making sure that parents understand it's not a good idea to take your child to bed with you, or to take your child to put them on, on your stomach when you're on a couch and sleeping. That's a danger, right?
Yes, it is. And our intake workers and our region workers, that's one of the things that we educate our staff on, is when they go into the field and they're working with parents and caretakers with infants, is to look at what the safe sleep area is, where babies are sleeping, and educate our parents on what that means. And when you feed a child, or it's the middle of the night and you have a late night feeding, that means put the baby back into the crib when you're done feeding the child. Don't fall asleep in the recliner. Don't fall asleep in the bed with the baby.
These are good things to keep in mind. And one more, Dr. Roberts, I didn't know secondhand smoke could be so dangerous to infants.
Yes, it can be. Secondhand smoke, not just the mom smoking while she's pregnant, but any exposure that the baby has after they're born to anyone who's smoking can be dangerous as well to the baby. And we've seen some correlation there with babies who have died in their sleep when they're exposed to secondhand smoke.
Well, this is wonderful information, and I want our viewers to know that there is more on the Franklin County Children's Services website where they can find more information, and also on yours at Columbus Public Health as well. Thank you both for sharing this information.
Thank you.